This following segment is sponsored by the Prince George's County Department of Health. Prince George's County has a decreasing number of new HIV cases, yet the county is still #1 in the state when it comes to new HIV infections. I spoke to Division Director Diane Young about how the county is working to end the epidemic. Diane, it's great to see you again. We know that the campaign has been heating up to end the HIV epidemic in Prince George's County. What is really behind this that's driving that campaign?
Thank you for asking that question. So ending the epidemic in Prince George's County came from the federal plan for ending the HIV epidemic in the United States. It's a historic plan that was announced in February 2019 aimed at ending the HIV epidemic in the United States by 2030. It includes several HHS agencies, which is the Health and Human Service Agency at the federal government. And that included some additional resources that were allocated to the jurisdictions that were included in this first phase. Unfortunately, Prince George's County was included because we are part of the 48 jurisdictions that have more than 50% of the new HIV cases.
Wow. And I also saw a couple stats surrounding this, that when you think of Prince George's County, 62% of the population is African American, but the new HIV cases that are found, 80% of them are for African Americans. Are you guys doing anything about that to address that disparity?
We are, Ellen. We're focusing on our local plan that was developed with our Community Advisory Board. Our goals align with the federal plan to reduce new HIV infections in our community by 75% in 2025 and at least by 90% by 2030. Specifically, our plan included adding a community-based advisory group that has an array of people from our community, including media, that is guiding us on stigma elimination, social determinants of health, and targeted community outreach. We've also developed a community media campaign, such as this one, to increase awareness around HIV diagnosis, treatment, and prevention.
Yeah, so important to get the word out there. I think of the last year, more than that COVID-19 in the health realm has really been that focus. How do you still make sure that residents are able to get access to the HIV prevention and those treatment services as well?
Sure. So we have never closed on COVID-19. When we were called to action to develop our Emergency Operations Center, our clinics remained open and our clients continue to access care, and they're doing quite well. They can continue to call us at 301-583-3150, or they can access our county website, princegeorgescountymaryland.gov, to look at our services offerings.
Excellent. So there's places they can reach out to, phone, find you guys online. Any call to action you want to stress and leave people with at home?
Oh, I do. I want to just stress that thanks to the advances in antiretroviral therapy, which is the medicine used to treat HIV, individuals with HIV who take their medicine as prescribed can become undetectable with their viral load. If they're undetectable, they can't transmit the virus. They can live long, healthy lives and effectively have no risk of sexually transmitting HIV to their partner. And I really want to stress that those that are having unprotected sex without condoms, they have access to pre-exposure prophylaxis, which is PrEP, a daily regimen of 2 oral antiviral drugs and a single pill that's been proven highly effective in eliminating the risk of transmission if you are HIV negative and have an encounter with somebody who is HIV positive. We also have an ongoing, an ongoing syringe services program to exchange syringes for those that continue to use syringes for drug use within our county. We have new laboratory techniques that allow us to pinpoint where HIV infections are spreading most rapidly throughout the state. And throughout our county, so that we can track any outbreaks that are going on. We believe with these powerful new tools that we can actually end the epidemic within our county.
Excellent. Great information for people to know at home. Diane, thank you so much for joining us again.
Thank you, Ellen.
And for more information, just type #CancelHIVPGC into your search bar on your phone or your desktop, and you will see plenty of information there.